Hi everyone, my name's Linda. I'm a community pharmacist here in Wellington, and we're going to have a bit of a chat about pain medication. So the role of medications. So we're going to be talking in depth about three different types of classes of painkillers. We're going to talk about paracetamol, which I'm sure a lot of you are familiar with. We are going to talk about non-steroidal anti-inflammatory drugs, and the abbreviation for that is NSAIDs. So you might hear me say that a bit. And we're also going to talk about the stronger painkillers, the opiates. We are going to talk about how these medications work, side effects of these medications, and how to take them appropriately. We are not going to be talking about other types of painkillers, such as things for nerve pain today. We're just going to talk about these three that I have mentioned. So let's dive in. We're going to talk a bit about where painkillers work. So of course painkillers are, their more technical name is analgesics. And as you can see in this slide, right down the bottom there is the site of trauma, the site where the pain has occurred. And we can feel that pain there. And it is also, the brain reacts to that pain also. And what we have is at the level where the trauma has occurred, so down in the body, that's pretty much where the NSAIDs are working. They're working at the site of pain. And then you've got paracetamol and the opiates working up to block the pain going to the brain. So that's what's happening with the different medications and how they are affecting how we feel pain. So we're going to talk a bit about paracetamol. And this is probably the most common medication, particularly for arthritis pain. We are really not entirely sure how it works. It is thought that it works by affecting some chemicals in the body called prostaglandins, mainly the prostaglandins that are in the brain. But strangely, they're not really sure how paracetamol works. And this does happen with quite a few drugs. We're not totally sure how they work, but they work, and that much we do know. So, and they work safely. So when we block prostaglandins, the body becomes less aware of pain and injury. We are going to talk a lot more about prostaglandins when we talk about NSAIDs, so I won't say much more about them right now. One of the main things with paracetamol is to take it correctly. The adult dose is 1 gram, and of course the standard tablets are 500 milligrams, so that is 2 tablets. It's up to every 4 hours, but no more than 4 grams in a day, which is about 8 tablets. It really is quite important if you're taking paracetamol to take it regularly and to take the right amount. Taking too little won't be effective, and you might get a bit disheartened that it's not effective, but it may be that you're just not taking enough of it. Some people do find it a bit of a problem having to take it 4 times a day, but it does seem to work best that way. Paracetamol is generally very well tolerated. We don't usually see too many side effects with it. That said though, all drugs can cause side effects. The most common ones are rashes and headaches and stomach upset and things like that. We don't usually see much of that with paracetamol. Its main issue is it's quite dangerous in overdose. It's really very harmful to the liver, and you must always be very, very careful with paracetamol with children because it's very, very dangerous and overdose with children. We do have some adult patients that struggle taking tablets, and they will have liquid. So really you must be very, very careful when you have the liquid in the house if you have children visiting occasionally, because it is really quite dangerous in an overdose. So that's pretty much paracetamol. And now we're going to launch into the NSAIDs. And there, as you can see, there are quite a few of them. So the common ones, and I'm sure from what our poll said, a lot of you are on medication, so I'm sure most of you will be familiar with these. So we'll run through them. So we have ibuprofen, and its brand names are things like Nurofen, Brufen, Fenpid, Ibugesic. As you most likely are aware, all drugs have two names. So there's their chemical name, and in this example, that's ibuprofen. And then different companies will make this product, and they will give it their own brand name. So the brand names of ibuprofen are Nurofen, Brufen, Fenpid, things like that. So I know it can be a bit confusing, the two different names of drugs, but that's where that's coming from. And the other common ones, diclofenac's very common, naproxen, tanoxacum not so much so. That's a very, very strong one, and we don't see that used very often. So the way that the NSAIDs work is they block enzymes that cause prostaglandins to be made in the body. And we're going to look at these a bit more in the following slides. And by blocking these enzymes, the pain, the swelling and the fluid is decreased. And so when we block the prostaglandins, there's less swelling and there's less pain. So let's have a wee look about how prostaglandins work. So this slide here shows us that when we have an injury, our body gets busy and produces prostaglandins, and these cause blood and nutrients to rush to the site, and their whole point of doing that is to promote healing, and that's what we want, but it does cause pain in that interim. And there are certain enzymes that are responsible for making the prostaglandins, and these are called COX-2 enzymes. And what the NSAIDs do is they block those enzymes. So basically, if those enzymes can't work, we don't get prostaglandins released, and we don't get the fluid and the inflammation happening at the site. And that basically is how NSAIDs work. Now, it's a little bit more complicated than that though, because not all prostaglandins cause us problems. A lot of prostaglandins, there are prostaglandins everywhere in the body actually, and a lot of them are very useful. So we have prostaglandins in our brain that help with memory and other brain function. We have ones in our lungs that help with breathing, and probably most importantly to do with NSAIDs, we have protective prostaglandins in the lining of the stomach, and these help to protect our stomach from stomach acid. We also have ones in our kidneys, and they're very important for keeping our kidney function up, and of course our kidneys are very important. There are ones in the uterus, and there are also ones associated, as we were talking about, with heat and with inflammation. So how to take them? It's very important that you take them with food, and because we saw on that last slide, there are prostaglandins in the stomach, and they get knocked out when you take NSAIDs. So it's very important you take NSAIDs with food to protect your stomach. It's very important. And sometimes your doctor will also give you medication, something like omeprazole or Losec, again to protect your stomach, because those prostaglandins there are being knocked out. And because they can affect your kidneys, the dose of your medication will be changed if your kidney function is down a little bit. And of course, some of the NSAIDs are immediate release and some are controlled release. And the time of day you will take them will vary depending on how quickly they release. So we talked a little bit about this. The main side effects with NSAIDs are stomach upset, And that is because we've got those prostaglandins in the tummy. So you have them with food, and you might be given another medication to try and decrease that side effect, and that would be omeprazole or maybe pantoprazole, something like that. Bleeding is a real issue with the NSAIDs. Because some prostaglandins help with clotting, the NSAIDs can increase bleeding, particularly in the stomach. So you really have to be wary of that. Some asthmatics will find that their asthma gets worse because there's prostaglandins in the lungs. And we do have to be careful with kidney function. So there are certain situations where NSAIDs really cannot be used. Obviously, if you're allergic to NSAIDs, if you've become allergic to them, aspirin should not be used under 16 years of age. There are issues there. Because you may have seen on that previous slide, there are prostaglandins in the uterus. They cannot be used, therefore, during pregnancy or breastfeeding. Definitely not if you're on blood thinners because of that bleeding issue. They're really not a good idea. Definitely not if you've got an active stomach ulcer. That's a no-no. Need to be careful if you have asthma. Not all asthmatics have an issue, but some do. Definitely care with kidney, heart and liver problems, and that's where your doctor will guide you. Some are safer than others when it comes to particularly kidney and heart, and your doctor will decide what's best for you. So we'll move on to opioids. So these are our really strong painkillers, and these are used to treat more severe pain. And they are similar to, our own body produces endorphins, and these make us feel happy and they make us feel content. And this is similar to how the opioids work. They work by blocking the opioid pain receptors in the brain, and they prevent the pain messages from reaching the brain. So we don't perceive pain the same way. They're usually divided into two groups. There's weaker ones and there's stronger ones. So weaker would be codeine is the most common, and dihydrocodeine, and then the really strong opioids, which is tramadol, morphine, oxycodone, pethidine, fentanyl as well. And even though the strong opioids are classed together, there's still difference between them. The difference between something like tramadol and fentanyl could be a factor of 10. So even within those two classes, there is a lot of difference. And so if your doctor feels you need to be on the very strong painkillers, there will be differences in the strengths of what they may be prescribing. How do they work? Now, this is quite different to the NSAIDs, and this slide is quite interesting, I think. It shows the opioid receptors, so that's those pretty little purple things, and they are distributed, again, pretty much all through the body, particularly in the brain, which you would expect because that's where they're working for pain, but they're also going through, again, through the lungs, through the heart, and in the digestive system as well. So if we just have a look at that for a wee minute, and if you just sort of keep that in your mind as we're looking at this next slide. So the side effects of the opioids, the most common is the gastric side effects, so constipation, feeling sick, some people do actually vomit, drowsiness, and because they're acting in the brain, they can make us, they're working in the centres that make us feel good. There can be issues with dependence and addiction, but when prescribed properly, addiction is usually not such a problem. So the adverse effects, the main things we're seeing are nausea and vomiting, because the vomiting centre of the brain can be activated by those opioid receptors. And the same with constipation. So while it's working to fight the pain, it is also activating those receptors in the tummy. And that is why constipation is such an issue with codeine. So the best thing is to be aware of it and maybe to take steps to avoid it. The next thing, obviously, is the drowsiness and sedation, again, because of those receptors in the brain. Can also be changes in heart rate. Not quite so common, that one. Finally, I think I just want to leave you with the most important thing with medication is to take the right medicine at the right dose at the right time. And I think that really is the most important thing with your medicine. So I think I will leave you with that.